Good morning to you, to Gisela, and to our audience tuning in from different places in our country who follow up and are aware of the information that we broadcast. Today, we'll start the briefing with the good news that we had no fatalities yesterday, and Cuba has today 334 COVID patients admitted in our hospitals, 14 in surveillance, 139 are suspects, and 181 are confirmed. These are the active cases we have today. In our primary healthcare system, our professionals and specialists follow up 664 people with certain risks. Yesterday, the island's different laboratories studied 2,543 samples. In the Pedro Curie Tropical Medicine Institute, 1,011. In Havana's Provincial Center, 469. In Villa Claras, 304. In Santiago de Cuba's, 280. In the Brother Ameijeira's Hospital Laboratory, 346. And in the Center for Genetic Engineering and Biotechnology, 133 samples. The labs did a great job and they could process the number of 2,543 samples. As a result of the study of these samples, 10 patients tested positive for COVID-19, 0.39% of all processed samples. Thus, in Cuba, 146,276 samples have been studied and 2,305 have tested positive. There is a question, and first let's take a look at this chart that is going to help us to call upon the reflection, to call all our people's attention on the importance of abiding by the measures and the rules that have been established. This first chart represents the confirmed cases by statistical weeks. The first, when the cases started to soar on the week from April 6th through the 12th, this is the moment when 349 cases were confirmed. Throughout the month of April, 366 cases followed, then 334, then 280, in the week from April 23rd through May 3rd. As you can see, throughout the month of April, large number of cases were confirmed. And following great efforts, early in May the cases began to drop, as you see. These are some bars that illustrates upticks, like the one on week 23rd, with 146 cases which are related to local transmission events. In the next chart, we can see all the peaks that took place at different moments, which correspond to different events that we had. For example, the events from El Cotorro, the event from Villa Clara, the event from Centro Habana. Each one of these events contributed an important number of cases. They are represented by these peaks. And I use this to illustrate the effort done by our country with the enforcement of the restrictions all over the country. And to curb the impact of this disease has not been an easy task. This is a virus with certain features that make it difficult to control it, and I called for the reflection so that our population, which starting yesterday in 13 provinces and the special municipality of the Isle of Youth, began to implement the first phase of the first stage, so that our population remain aware on the need of fulfilling the restrictions. And those of us who live in Matanzas and in Havana to do a little more since we have not been able to reach the first phase yet. So there is a curve which is going to be displayed on your screens. You know about this curve. These curves describe different scenarios regarding the pandemic behavior. The red curve illustrates the critical scenario, the worst. The green curve is the medium scenario, and the blue, which is the most favorable scenario where we had been maintained. And at some point, we had even managed to be below that favorable scenario. These are admitted patients, active patients. However, notice how at the beginning of June the number of cases went a little bit higher than the blue curve, and they are a result of events that were reported at that moment. And I reiterate that the need of these events being reduced to the minimum or being solved altogether, because a great effort has being put into by our state, by our parties, so as to keeping the situation under control. And I am sure that we, all Cubans, will continue doing our best so that this situation remains as it is. Of the 10 cases confirmed yesterday, all are Cuban, 5 are confirmed case contacts, accumulating 2,013 people who have been studied and who have been positive case contacts. This represents 88.51% of all cases confirmed in Cuba. In 5 cases, the source of infection had not yet been determined, accumulating 99.4% of all confirmed 4.37% of all confirmed cases where we work to trace the source of infection. We always mention the 161 people in our country who have contracted the disease abroad. And of the 5 patients without source of infection determined, we had today, we should say that 4 of them were identified through population studies. And this is the importance of this kind of probes conducted in places where no cases of the disease have been confirmed. These cases are not a result of a study of confirmed cases, but on population studies. Two of the diagnosed cases yesterday are male, for a cumulative of 1,163 people are male. 50.45% of all cases confirmed in Cuba, and 8 were female yesterday, for a cumulative of 1,142 patients. 49.54%. Notice how the behavior of the pandemic in terms of sex in our country is very similar in terms of the amount of people confirmed. 7 of the positive cases were asymptomatic, for a cumulative of 1,244 people, 53.97% in the evolution of the pandemic in Cuba, who have been asymptomatic at the moment of the diagnosis. Therefore, the importance of the fulfillment of the protection measures. However, over the last 15 days, this trend has changed, because in the last few days, 77.2% of the confirmed cases in the last 2 weeks, 122 cases, have been asymptomatic at the moment of the diagnosis. This means that this high risk group, who usually do not go to the doctor and are not detected unless they are submitted to special studies at the community level, they spread the disease. By age groups, there are 4 cases diagnosed yesterday in the 20 to 39 years of age group, 4 in the group of 40 to 59, and 2 cases in the group of 60 and over, 40, and 20% respectively. No children were diagnosed yesterday with COVID 19, and there is no change to the number of 249 who have tested positive in Cuba, of which 231 of them have been discharged. That is 92.8%. All 10 diagnosed cases belong to Havana province, distributed in 10 municipalities.